Well, the province of Alberta has seen the third wave of the pandemic running wild. The province now has the highest rate in North America of infections per 100,000 people. It is double the rate of the province of Ontario. Pressure mounting for tougher restrictions in the province to try and bring the spread under control and protect a strained healthcare system from collapse. Dr. Noel Gibney is the co-chair of the Edmonton Zone Medical Staff Association's Strategic COVID-19 Pandemic Committee, and he's with me now. Dr. Gibney, first of all, thanks for taking time to speak with me today. I do appreciate it.
Thank you, Peter. Thank you for having me.
How much trouble is Alberta in right now with what seems like this unchecked spread of COVID?
Alberta's in a lot of trouble. I mean, the numbers in large measure speak for themselves with, as you mentioned earlier, twice the rate of Ontario and now the COVID capital of Canada and United States.
To give it some perspective, as I touched on, Alberta's 7-day average of cases per 100,000 people is now roughly double the Ontario numbers. Alberta is now, as you said, tops in North America. How did it get so bad?
I think that's a really good and important question. I think there were two components. The first is that after the second wave, the Alberta government started to open up too early, particularly with the arrival of the new B.1.1.7 variant, which spreads more rapidly. This kind of spread slowly in the background, and then at a certain point in time reached a critical mass, which was in early April. It was clear to us probably towards the end of February onwards that we were going to get ourselves into significant trouble. And despite that, because I'm sure the government had similar modeling, they continued to open up at a rate that was premature given the arrival of the new variant and the numbers that we were seeing. So I think we opened up too early. The second problem is that even though we've recognized for quite a while now that we're in trouble, the government has simply not introduced public health restrictions that are strict enough to get control of this new variant. Our numbers are such that we recognize that if we continue on the current pathway with just the current levels of restrictions, by the last week of May, the healthcare system will be overwhelmed, and Alberta Health Services will have to introduce the newly announced critical care pandemic triage protocol, which would be really an extraordinary event and one that we really do need to avoid.
So that could be a few weeks away, and I was going to get to that. And to be clear, so people understand what we're talking about, this triage protocol that you and your colleagues have worked on, they're life and death decisions, right? It comes down to who you think is going to be in the best position to survive based on the emergency treatments available, and you have to make choices about who lives, perhaps, and who doesn't.
That's correct. And emergency triage procedures, they're typically kept in a locked drawer until a disaster occurs. This is unusual because, generally speaking, they're used in a situation, say, for example, a major earthquake was to hit Vancouver. At that point in time, it would be very clear nobody was expecting it. It happened, and people would have to implement that kind of a protocol. What's so different about this is that we know that this is going to happen. We know how this can be averted. And yet, despite that, our government is continuing ahead on exactly the same trajectory towards what will be a disaster. And that is an extraordinarily, irresponsible approach to take.
We have seen the Premier announce some new restrictions on hotspot cities in the province last week, shutting down indoor fitness centers and pools, and some high schools are going to be closed for left only to virtual learning. Is any of that going to be enough to stop what's happening?
No, not really. We simply have to introduce a firm lockdown, somewhat similar to what was here in the first wave in Alberta last year. Alberta had a very strict response. It resulted in the first wave being managed very efficiently and without any difficulties. And so I think we simply have to go back there. The real challenge that I think we're dealing with at this stage is that the government, its base, simply are rebelling against any form of restriction. And I think that the government's weak response to this is giving them encouragement.
Yeah. Well, I wanted to come to that. I wanted to get to that. We saw a very publicized, a small minority of Albertans ignoring the rules this past weekend, with hundreds of people, maybe a couple of thousand, attending a no more lockdowns rodeo on the weekend. Police were there, but they didn't try to stop it. And the Premier tweeted that it's a slap in the face to everyone who is following the public health orders. But do you wonder why more is not being done on the enforcement side? And do you wonder about the messaging coming from political leaders in Alberta?
I think the messaging is one of the major problems. On one hand, the Premier says this is a slap in the face, but unless he actually does something forceful about it, there's no reason that individuals won't continue to behave this way. We saw earlier this year at the Grace Life Church west of Edmonton continue to operate maskless and with large numbers of people attending for 6 months before enforcement was taken. And there's very clearly a lot of mixed messaging coming from the Premier.
All right. Dr. Gibney, thanks for taking time to speak with me about this today. And all of us are watching in the country what's happening in Alberta, and we hope you turn a corner there soon. Thanks for the time today.
Thank you very much, Peter.